Welcome everyone. So tonight I have the pleasure of introducing Hayley, an experienced exercise physiologist with special interests in vestibular rehabilitation, exercise oncology and mental health. Hayley's been working within the vestibular rehabilitation over the last 5 years and is considerate to both the classic forms of vestibular rehab as well as a holistic exercise involvement for both health and pleasure. She has experience with pathologies including Meniere's, migraine, hypofunction, neuritis, persistent postural perceptual dizziness, that one's a mouthful, and Maladie-Debarkment syndrome. Being active is a large part of Hayley's life, and she understands how important it is to encourage and support others to also achieve an active lifestyle. And Hayley will be presenting tonight, Exercise in Medicine, Why Dizziness Doesn't Stop This. Over to you, Hayley.
Awesome. Thank you so much, Mickey. It is lovely to meet everybody, well, virtually, I guess. I can see all the names listing through. So the session tonight is full of some information. I'm going to try and move relatively slowly throughout it. If you have any questions that are quite specific to a particular slide, I'm quite happy for you to put them in the chat or raise a hand to field them immediately. But if they're more generalized, I've left plenty of time at the end to answer some questions, because I'd really love it if you guys had some specific questions around this. I think it's a really, really important topic, and it's something that I'm very passionate about, and I'd love to give you all as much help as I can while I'm here. So I'm going to move slowly. Apologies for the slides. My screen wouldn't quite share properly. So across the session, we'll tell you a bit more about me, because I think that's quite important. I'm going to talk to you about why exercise is important, why it's not just something that we could flick off the cards every day, why it's something that's really, really important to our holistic health. I'm then going to talk a bit about habituation and how important that technique is in having someone who has dizziness, Meniere's, migraine, whatever it may be, actually reintroduce themselves to some of the tasks that are important for their health, but are also important for managing their symptoms. We're then going to move on to a little bit of goal setting and motivational discussion, because I want you all to leave this session tonight with an idea around how you can start to implement more exercise. Even if you're doing plenty already, maybe you feel like you're doing plenty already, is it actually meeting what I'm suggesting you should do? Or maybe you just need to start somewhere, but I want you all to have a goal. I would love to have conversations with you all further if you'd like to flesh those out, but we're going to work together and then, of course, answer some questions. So if you need me to pause, throw something into the chat. If I'm going a little too fast, please also flag it. I'm happy to revisit some information, but my hope is that we move nice and steadily through this and that it's not too overwhelming for you all. So about me, I am an exercise physiologist. So I obviously specialize in vestibular rehabilitation, otherwise I don't think I'd be here. But I also work quite a lot with neurological conditions as well, which is quite broad. And that's sort of how I got into vestibular rehab. So for those that don't know, an exercise physiologist is a health professional who manages chronic conditions and injuries through the prescription of exercise. So if you compare me to a physiotherapist, the main difference is that I can't do manual therapy and I can't diagnose. So as an example, I can't perform Epley maneuvers because they are more manual therapy based, even though it's a little bit different. If you compared me to a personal trainer, the main difference is that I went to university for quite a long time to do all of this, and my knowledge on how the body works and why it works the way it does is a lot more in depth. But I'm probably more closely related to a personal trainer than a physiotherapist in terms of what I do every day. I'm also a life program facilitator. So some of you, well, actually most of you might not have heard of this. It's a Victorian-based incentive, which is essentially talking about lifestyle behavior change for the management of chronic conditions. And I thought that was somewhat important for me to tell you guys about tonight, because it makes a large basis of what I'm going to talk you through. And it's a really good website, actually. So if you have more questions about the general exercise recommendations I'm providing, the life program website's a really good one to visit. But yeah, I love exercise. I love moving. I grew up dancing 30, 40 hours a week when I was 16, 17 years old. Before that, I swam competitively. I love hiking. I love cycling. I just like being out of the house. Just don't like being cooped up. And I truly believe that exercise is important for our holistic health, But above and beyond that, we need to enjoy it and we need to love it, because it's something that we need to do for our life. And we need to find ways that that can be pleasurable for us above anything else. So why exercise? Exercise continues to be identified as a key component in the prevention and management of many complex and chronic conditions. Think about type 2 diabetes, cardiovascular disease, our weight management, our waist circumferences, general health and well-being, even things like management of MS and Parkinson's. Exercise has a very key role to play in very different ways in a lot of those complex conditions. When we become more sedentary, our risk of developing other chronic conditions or comorbidities is even heightened. So if you've unfortunately got cardiovascular concerns, maybe our blood pressure is a little bit elevated, if we are sedentary and spending most of our time sitting down, we are at far more risk of developing broader pathologies in and around that. And we don't want that list to keep growing. That's not the sort of list that you want to have continue to grow, especially when we may be managing a chronic dizziness condition, which is limiting your movement and affecting your health in other ways. We can't avoid some of the risk factors for these pathologies either. Our genetic history and our genetic predisposition really increases our chance of getting things like diabetes and osteoporosis or osteoarthritis. And we have to acknowledge what has been in our lineage and what we need to actively be doing to avoid those. And that can be quite hard, and it can be quite overwhelming if movement isn't something we've typically gone about, but movement is a really key player in all of that too. The hard part is being dizzy doesn't stop it. We can't just brush exercise aside, brush our family history aside because someone is suffering from dizziness. It is something that we have to learn how to move around and we have to learn how to manage. So I'm going to tell you about how much we should be exercising, why different types of exercise are important, and then we'll go into some more specifics about how maybe you can consider introducing yourself back into those environments. So a few different basic breakdowns of exercise. In theory, it's far more complicated than this, but we just need to do the basic facts. So aerobic exercise. Aerobic exercise is something like walking, running, cycling, swimming, dancing, that's quite repetitive. It is allowing our cardiovascular system to consistently take in air and cycle through, and we can typically do these tasks for an extended period of time. Aerobic exercise is really important for improving cardiovascular adaptations that increase our peak oxygen consumption. So this essentially means we have improved cardiovascular function and often end up with reduced blood pressure. There's a bit of an asterisk next to that though, because it's quite important that we have resistance training in the mix for blood pressure management, but nonetheless, walking is very important in that. Many of you may have heard that having a lower resting heart rate is quite good for us. Essentially, the more aerobic exercise you perform, the bigger the left ventricle of our heart is, which means it has more power to push blood through our system, which means our blood has to pump less frequently to have our entire body become oxygenated. And that means our heart is not working as much, and it is at less risk of having an overuse injury, if you want to put it that way. We also, in aerobic exercise, use far more body fat and fat stores for the energy of that exercise. So it is breaking down fat molecules as we're exercising, particularly 15 to 20 minutes and onwards. And so it's far better at reducing your overall fat level in your system if that is potentially something that you're interested in or wanting to change in the mix as well. Obviously, there are many, many benefits to aerobic exercise, but I think the key players in our holistic health are around cardiovascular adaptations and fat management. Resistance exercise is a little bit different. So we can do things like body weight exercise, like push-ups and step-ups and squats. We can do weight training, so adding in dumbbells or barbells or even machine weights. And we can include plyometric exercises into this category. So plyometric exercises are exercises where there's jumping or like impact and springing and power involved. Resistance exercise over time improves our neuromuscular adaptations, and that's how we increase our strength. So some of you might have heard that every time you lift and move a weight, the little muscle fibers kind of pull apart and they have to reheal, and that's how we make more fibers and we get stronger. But it's also about how our brain utilizes those muscles and continues their efficiency over time. And that crosses over with our aerobic system, but we want to actually grow our muscles in and around that too. Having more muscle mass means that we have more lean body mass. So essentially our ratio of fat to muscle is improving to favor our muscle, which means that we use more energy every time we move. And that is a key one for weight loss as well. So a lot of people historically have been told aerobic exercise is most important for weight management, but it's not necessarily the case. Resistance exercise can play just as big a part. And if you're somebody who struggles to do a lot of frequent, consistent exercise, such as walking or running, resistance exercise can play a potentially good role in your management because it still has some really good outcomes as well. Bone health is also something that is very, very important in relation to exercise. And I felt like it was a particularly important topic to cover in relation to dizziness because falls risk is quite high in people who are dizzy, and bone health being low and falls risk being high don't work out the best together. So when we perform resistance training in particular, we can have an increase in muscle mass, which means an increase in muscle endurance. So you can use those muscles in the same way for a longer period of time. But it also increases our weight bearing ability, which improves our bone density and reduces our chance or continued development of osteoporosis. So plyometric exercise is also a very important one in this scenario. We want weight bearing exercise to improve bone health, which is where unfortunately swimming and pool work like hydrotherapy isn't as helpful. It's brilliant exercise, and I'm not going to knock it if it's part of someone's routine at all. But when it comes to improving bone health, being in the pool doesn't actually do heaps for you. Being on land is better, but being on land and jumping is even better again. So if we're looking to improve bone health, we can start off with things like loaded stepping. It doesn't have to be this big jumping task where we're vigorously shaking up our system. It can just be adding a bit more load, walking with a backpack, adding more weight through your body and processing it through that way. Cycling, I can see a comment just there in the chat, and I'm going to answer it while I'm on the slide. So the question was, is cycling good for bone health? It is and it isn't. It's a similar category to walking, in that cycling is a great exercise and we're getting lots of resistance. So we're getting lots of strengthening happening through our legs during the riding, but there's not really a lot of consistent impact down onto the pedals. And so the loading on the bone is there, but it's not as good as jumping or running, as an example. So cycling is better than the pool, but it's probably not as good as running or landing exercises. I want you to all consider how good your bone health is, because if you have a higher risk of falls alongside dizziness, it's quite important that our bone health is in check. And it is unfortunately one of those things that does deteriorate, particularly for women postmenopausally, but is also quite prevalent in older men too. So once we're hitting about 75, 80 years of age, that's when it seems to creep in a little bit more with men. And the more work we do from a younger age to improve our bone structure, the better. You can see quite comfortably here that someone with osteoporosis has a lot more space between all of the structure of their bones. And that is how you end up with a few issues, because you've got more fragility in the inside of the bone and you're far more likely to have that become an active issue. How do you assess bone health? That's another question that's come in. So once I can't remember the actual age, but Medicare wise, I think it's over 60 or 65, you're eligible for a DEXA scan every 2 years. And so a DEXA scan is typically the way that they will assess bone health. There's a number of ways it can be done, but that's the easiest way. They sort of scan your system as a whole, and they can pinpoint key areas, normally through the spine and through the hips, to identify where there's less formation of that bone, and that's what can lead to, you know, shrinking as we get older, or more fragility in hips. And it's something to be really, really cautious of as we get older. They're quite pedantic on making sure anyone over the age of 70, particularly women, get their DEXA scans done and their bone density scans done. But just go and talk to your GP if you're interested in it and you think you're eligible. You might have actually had one and you're just not aware, but talk to your GP about it. That's a good place to start. So generally speaking, how much exercise should we be doing? So the Australian Physical Activity Guidelines currently recommend 150 minutes of a moderate intensity aerobic exercise per week. So that is 30 minutes, 5 days a week, at an intensity which is enough that you couldn't hold a consistent conversation. So there's something called a talk test that we like to implement into our intensity testing. And that is essentially, if you're performing an activity and you could sing, it's too easy. If you're performing an activity and you can barely speak a word, it's vigorous and it's harder than we're talking about here. But if you're holding the conversation and your phone rang and you picked it up and you went, oh, yep, sorry, I'm just running, I'll call you back. That's probably a moderate intensity. By all means, you could be walking with a friend and having a bit of a chat, but every now and again, you need to kind of stop and catch your breath. That's a moderate intensity. So it's actually a really important consideration with that. Plenty of people probably achieve 150 minutes of, say, walking every single week, but it's potentially not actually vigorous enough or at that moderate intensity, which is causing the most adaptation for our system. If, for example, your favorite sort of exercise happened to be vigorous and you happen to love running or cycling, gets you super out of breath, that time actually drops down to 75 minutes per week, because a higher intensity form of exercise tends to be a little bit more efficient and effective on our physiological health. In terms of strength training, so resistance training, which I was referring to before, including anything for bone density, a lot of the time, we're looking at 2 to 3 sessions per week. So I normally start people off with 2 sessions per week to get settled into things. And then you want to try and throw a 3rd session in. And those sessions work best when there's a fair bit of variety involved. So that doesn't have to mean that, you know, 1 session's in the gym and 1 session's focused on jumping specifically. It's mainly looking at continuing to allow adaptation in our system. Our body responds best when there's lots of stimuli to consistently change to, and having a progressive program, or what we call a periodized program, is quite important for that. So an example of a periodized program might be we're working over a 12-week block of time, and that 12 weeks is split into 3 chunks. The first chunk, you're working for maybe 12 to 15 repetitions of an exercise. The middle chunk, you're increasing the weight and you're working for less repetitions in an effort to continue to build that strength. And then the last block of time, you increase the weight quite a lot again, but even less repetitions. And so by the time you finish, you're potentially lifting a fair amount more, 20 to 30% more than you were at the start. But we've tapered that out and allowed for your body to adapt to that by changing the repetitions around. Resistance training, in all honesty, in an open group like this can be quite difficult to give specific suggestions to. So if there's things that you like to do from a resistance standpoint, it's worth maybe talking to an exercise physiologist if you feel like you need some more guidance around it. Better, best in the business. But if you have some personal trainers that you trust and and you talk to, they're also a good place to start. I had another question come through that says, what can you do aside from weights? You may not want to join a gym. And that is 100% correct. I think a lot of the people I see every day have no intent on joining a gym because it's just not a nice environment. It's a bit macho sometimes, but even just having to get there can be a risk. Yeah, someone said resistance bands are a good alternative to weights, and that's 100% correct. Resistance bands are a lot more gentle, and they're super cheap and affordable, and you can just attach them to your doorknobs at home. Body weight exercise can be super effective. So not even holding any weights, just using your own physical weight is just as good sometimes. Or even just things around the house. I've had people do exercises with tins of food or bottles of milk bottles that we've filled with water or sand or something like that. But there's normally something, I've had people literally just fill a backpack with a few books, and that's a little bit of weight to add into it. So by all means, it's nice to have a convenient weight that just says the number and you know exactly what it is, but there's so many ways around it. Mobility and stretching on most days is another really, really important thing to be considering. And this is where things like yoga and Pilates fall into the mix. So there's a bit of an overlap. Aerobic exercise and strength training will overlap, because when you do strength training, you're going to get a bit huffy puffy. And that's when we think of it like aerobic exercise. Very often aerobic exercise has an element of resistance into it, like cycling uphill, and that would give you some more muscle strength as well. Yoga and Pilates are both classified as low intensity resistance exercises. So by low intensity, it's more that it's often not a high load of weight, but it can be still very challenging if you are in some very, very difficult classes. There's nice grading options. So mobility and stretching can be as simple as, you know, you've got a hamstring stretch that you do every day because you've got an old injury, or you manage your sciatica by stretching first thing in the morning. But it can be as useful as Pilates and yoga. And to be honest, once yoga and Pilates are tolerated by someone who is dizzy, I think they're some of the best exercise forms for you, because they expose you to a lot of movements and a lot of positions. And provided you don't have a strong history of BPPV, I feel like it can be a really, really good way to be more familiar with a lot of the movements we don't do naturally day to day just by standing and moving around. A few other questions coming through. So Tai Chi would be classified as a stretching or mobility type exercise, if we're looking to categorize that more specifically. So it's the sort of thing that's not too strenuous on our system. It can be tolerated quite well. Oh, I had another question come through. Let me just kind of scroll up to it and see. Yes. Okay. So someone is bringing up the fact that they get quite motion sick doing some aerobic exercise. And absolutely, I expect a lot of you would struggle to meet these guidelines potentially because of your symptoms. And there are positions and there are movements that you guys would be wanting to do. Maybe it's something you've historically done that you love, and it just feels like you can't break that barrier. And by all means, I'm going to be talking quite broadly about habituation and how we can start to work towards adaptation to some of those tasks. But without talking to you specifically, it's going to be difficult to break that down fully. And that's why I'm quite happy to have more conversation with you after this. But yes, it is very important to consider your symptom responses when it comes to these exercises. So the main thing I have to say is, regardless of your symptoms, these are technically the physical activity guidelines you should be achieving. And that's not something I like to say to people, because I like to be a little bit more caring than that. But the harsh reality is, this is what's recommended for our best physical health and fitness holistically. Does that take into account being dizzy and being triggered? No, of course it doesn't. It takes more into account weight loss and cardiovascular health and plaque buildup in our arteries, and muscle loss over time. But regardless of our current symptoms, we want to try and aim towards this as our ultimate goal and find ways around it. And that's what I really want to move on to talking with you guys about tonight and now, is how does this even work when you feel as horrible as you feel sometimes? So habituation. This may be something you've done in vestibular rehab. If you haven't done vestibular rehab before, it might be completely unfamiliar, but it's something you won't be aware that you've done, even if you haven't heard of it before. So for the sake of this, I'm going to presume that you've completed some typical vestibular rehabilitation. If you've done that block, what are you still avoiding? So I want you to actually sit there and think about that. Maybe if you need a pen and a paper, actually take an opportunity to go and grab one at this point, because I'm going to talk you through and we're going to do some goal setting. So make sure you got something handy. What are you still avoiding and why are you still avoiding it? I want you to think about the symptoms that trigger. Are those symptoms unique to that situation? Are they connected to other situations? Like really deep dive into why you don't do the things you don't do. Once you've thought of that, have a think about what you could do to have your system understand those movements more specifically and to feel less threatened by them. And that's a hard thing to say, right? It's easy to say, oh, you know, just try it. But when you feel so horrible sometimes, you don't want to try it. It's not worth trying it for a lot of people. But if you don't try it and you don't work out what you can tolerate, it just stays how it is. And if you're avoiding something that you're passionate about, or maybe you're potentially actually risking other parts of your health because of that one risk, you know, we've got to weigh up that risk. And that's where having a professional to talk it through is really, really useful. But we need to desensitize your system to those annoyances. Again, something like BPPV is a little bit different. We know that there is a particular position that might trigger that for somebody. But if we're talking about vestibular migraine annoyances or Meniere's annoyances, absolutely there is a huge list of things that will trigger people, but it's about working out what it is for you and what part of that activity might have been the issue. Once we know that, we can then make an exercise out of it. So as an example, my vestibular rehabilitation with people, and I'm in a slightly unique setting where I'm not a physiotherapist, so I'm not doing much manual therapy with someone. I'm only delivering exercise. I'm just the mean person making them do stuff. But if they've done some basic head turns, some basic stable gaze exercises, I want to know, is it just looking down that's the issue? Is it looking up? Is it moving really fast? Is it lots of acceleration forces that's causing the problem? Is it visually seeing things move, or is it feeling things move? And then I want to break that down and I want to make that its own exercise, because we have to be super careful when we're talking about habituation to gradually expose someone to something. Habituation is most typically used for phobias. You know, someone's got a fear of an insect, as an example. You don't just hand them the insect and hope that they'll deal with it. You start with some discussions around the insect, and then maybe you introduce some themes or some photos about that, and you work your way towards handling the insect. And I want you to think about your avoided activities in the same way. You're not going to get there if you just jump straight into the deep end the way you thought you always could do it. It's just not going to work. And you can try it and it's going to feel horrible. Maybe you'll luck it out once in a while and it'll be okay, but we need to pare it back. We need to strip it down. So daily habituation is probably something you've all experienced. Habituation happens when you repeat things steadily over time. So a good way to think of it is maybe flash back to when you were when everything kicked off, when everything was quite aggravated and you were starting to understand how things worked, and think about a task that you avoided. Think about something that you didn't do that you can do now. And how did that happen? Did you just persist? Did you break that down? And if you just persisted, that's just habituation. You just endure the bad bit first. And then can you think of anything that's still an issue? Is there still a task that is quite triggering for you that maybe you'd like to change? You know, we're talking about exercise specifically, but habituation works in our day-to-day life. What would you like to do that you can't do? And how can we look at using this technique to be able to do that? We need to reverse engineer the exercise. And maybe that's easy for me to say because I spend my whole day delivering exercise, but think about the position of your head. Our vestibular system is so gravity sensitive that just because you can do a task looking forward doesn't mean that same task can be done lying flat on your back or leaning forward or tilted to the side. They're very different. You have to train them in those positions as well. It's tricky. You've actually really got to break it down and build up that routine and understand how much repetition of a movement you're going to do. The daily habituation or habituation generally will give you the best results if you can start with this tiny little amount every single day. And that tiny little amount gradually builds out to a bigger amount and hopefully builds out to an amount which is actually reflective of the task you want to do, or maybe an amount of exercise that's really meaningful for physiological change and for our overall health. I had a question that popped up, and that is, would habituation or desensitization program include meditation techniques? And for me, it's a yes. But It's a yes in the sense that it is a way of reducing the stress response and the anxiety around that task. So depending on how sensitive somebody is, sometimes I will do a meditation strategy with visualization to start off with. So example being, maybe I want someone to be able to stand on a rocker board. And a rocker board, they jump on it for 30 seconds, they step off, and I can't do anything else the entire session because I've triggered motion sickness. I've triggered that rocking, bouncing sensation that just will linger for hours. That is the sort of situation where I will start with a meditation or a visualization technique first. That technique then becomes a grounding exercise so that when we expose them to the task which is uncomfortable, you can then pair it with the meditation activity afterwards to bring back control. And this is only effective if you've done it in a small enough amount. If you've jumped too far ahead and we've really irritated the system too much, you'd all be aware pulling it back isn't very easy if we've gone that far. But if we just scratch the surface, just enough to get a small amount of irritation initially, we can start to reduce that anxiety response around it. And of course, the more you tolerate it, the less anxious you get about it. We stop that spiral, that negative feedback loop that happens, and it becomes a lot easier to manage those situations too. So an example for you, swimming. Swimming is such a good activity for us, but I've chosen it because it's in a very different position to standing. So consider lap swimming. Maybe you've worked through some aggravation and you've done some rehabilitation and you get back into the pool and you're kicking on a kickboard, and that's all good. And the first time you go in to do some lap swimming, you go, oh, I'll stick with some freestyle, I'll keep it simple. And you flare. And you flare horribly and you go, oh my gosh, I can't do that again. But you think, oh, maybe I'll just try a little bit less this time. But you still flare. What's causing it? Maybe the right to left head movements. Maybe you've practiced those movements, and maybe it's the fact that you haven't practiced those movements with your head down in a different gravitational position. Maybe your aerobic system is stressed more than it normally would be, and you're exerting yourself more and you're getting out of breath, and maybe that's contributing to the stress. Or maybe it's the sound of the water or the feeling of the water in and out of your ears and rushing past your ears. There are so many things to consider. It's not always just the head movements. By all means, adapting to the head movements is really helpful, but you need to consider the environment as a whole. Then you need to think about what in that environment that triggered you, can you expose yourself to and break it down over time? If you try a head turn task, right to left, looking straight ahead, how does it feel? If you try that task again, looking down like you would be if you were swimming, how does that feel? Does that already feel different? And if it does, that's probably where you need to start. Or maybe it's the cold sensation of the water. Maybe that's what's tricking it off, or the auditory input that changes every time you're swirling your head. It's really hard to break it down, and it's hard to work out those triggers alone a lot of the time without over-analyzing a task. But if it's something you really want to get back to and you're struggling to push through the fear of doing the task, it's a really, really simple way to kind of feel a bit more comfortable with all of the elements that you can then bring in together. So as an example, without knowing a lot of other context, let's presume it's the right to left head movements that annoy somebody. Let's presume that they focus ahead on the line while they're swimming the whole time. So you've got some gaze stabilization going on. I'd probably start them off with a leaning forward head turn, or a lying on their stomach head movement and head turn with a set gaze going right to left, because you need that alternating sides to best reflect the pool swimming. And maybe, depends how much they're tolerating. Start off with 5 to 10 repetitions and see how it goes. I'd rather have someone do 5 repetitions 3 or 4 times in the day than have them do 20 repetitions once, because 5 is going to be far better palated. We can steadily increase that up, and I know across the span of the day, they're getting that endurance exposure. Okay, so having used swimming as an example, I want you all to set some goals. I want you to think about what you'd like to be able to do, what you've been avoiding. I want you to think about why, though. It's not just, I should swim because it's good for me. You really need to have a why, and you need to identify what barriers might exist. This image here is reflective of the stages of behavior change. And I think it's a really interesting one to have an idea of because it talks us through the various psychological stages of behavior change. And I like that it's a staircase because we don't just go up staircases, sometimes we go down them. And when you have flares and you hit a bit of a wall, sometimes we jump back down a few, and that's okay. So if we're considering something we've been avoiding, we're likely going to be in the contemplation stage or the preparation stage where we're aware of some issues. Maybe we don't want to change them or haven't thought of changing them. Maybe we're going to consider changing them and we're setting some goals out tonight. Acting on those goals is going to take you to the action stage, and maintenance stage would be when you are able to sustain that activity at a particular level. And it's likely that one particular task, maybe swimming, will move between an action and a maintenance stage in order to get you to the end goal that you've got. And that's why it's really important that you've got a good bit of motivation behind your goal setting. Looking at motivation more specifically, it's important that it's intrinsic positive motivation that we're going for. So this graph, I apologize for the lines on the side. Essentially, the left side is presenting extrinsic, which is someone's wanting you to do it. And the right side is intrinsic, whereby you yourself want to achieve it. Positive at the top, negative down the bottom. So at the worst end of what we're looking at, it's if I don't exercise, my healthcare team will be disappointed in me. Look, it's not necessarily wrong, but is that really good motivation to keep you going? How well are you actually going to remember your healthcare team in 5 years' time when that motivation is still important to be achieving your goals? Even family and friends and partners, that's good. It's helpful. They're far more supportive and close to you, but it's somebody else's expectation. And when you're trying to meet someone else's expectation, it's hard. You need to be your own cheerleader. You need to find your own ways that you want to do it. And you really want to care about what you're doing. It becomes more sustainable and you're more likely to actually work through and achieve those goals in response. So goal setting, this is my favorite way to set goals. Some of you have probably rolled your eyes at seeing SMART goals in there, but I stand by them wholeheartedly because it helps you to break it down and make it relatively achievable. So setting a SMART goal is essentially about giving your goal structure. I often use the example of, I just want to lose 5 kilos. That's okay. You've got a number there, so it's got something meaningful around it, but how? How are we losing that weight? What time have we got to lose that weight? Can I actually lose the 5 kilos in the 2 weeks that I was talking about? Is that realistic or not? So a SMART goal should be specific. It's specific to a particular goal. It might be, I want to swim 50 meters. 50 meters without irritation following. Measurable. We've got a distance attached. It's easily measurable. Attainable. Is it attainable? Probably. If you haven't been swimming much, but you've got a history of swimming, 50 meters is probably relatively attainable. As long as you've got a pool close by, that's achievable. Is it realistic? Yeah, it also is realistic. We're not sitting there saying we want to be able to swim 2 kilometers in the space of 2 weeks. We're saying we want to swim 50 meters. And then time bound. Have we got a time setting around it? How long are we taking to achieve this goal? How am I giving myself 2 weeks? Am I giving myself a month? And that's where it's going to depend on the size of the goal. But my suggestion is you want a goal that's going to take no longer than a month to achieve initially, because we all love instant gratification. And if we don't have that in the mix, you're going to drop the ball and you're going to drop the goal. So you need little stepping stones on the way. If you've got a big goal that you want to hit, let's say it's swimming for a half an hour in the pool. You can't start with that as your goal. You need to start down here unless you're already able to swim 20 minutes. If you haven't swum and 30 minutes is the goal, start with 2 laps. Start with 1 lap. Start with just getting to the pool. Honestly, it's so much more helpful if you can break it down over time. So I want you to try and set some SMART goals in and around some exercise specifically. Now, that doesn't have to be aerobic exercise. It doesn't have to be resistance exercise. It can literally be any sort of movement at all. By all means, like I said before, those physical activity guidelines are what we should be achieving for our best holistic health. But as a few people have mentioned in the comments and the chats, we can't all do that. Some of it is too irritating and too triggering at the moment. So it's about finding out what's meaningful for you. And maybe that is about having a talk to an exercise physiologist to understand what else is going on in your medical history. You know, is there something that's worrying you that you're not managing as well because of your dizziness symptoms? Are you a diabetic who was lifestyle managed, and now that you can't move very well, you're struggling to keep your blood sugars down? Or is it more how you feel? You know, you're struggling to walk because you're feeling dizzy, but you're noticing you're getting more out of breath because of it. There's ways that we can introduce exercise and introduce, I guess, stress to your system to allow adaptation to those tasks without always doing the traditional movement. And I won't lie, it can be difficult to find an exercise physiologist that's really well aware of vestibular conditions. I am not the most common of exercise physiologists out there, but they can be really, really good resources when it comes to understanding why movement's important to you. And if they're a good practitioner, they should listen or they should learn, and they should understand how they can best support and help you. So in summary, how do we exercise with dizziness? You have to pick something you love. You have to pick something that gives you that drive and motivation. It's not someone just pushing you to do it. It needs to be something that you want to do. And you need to set a goal. You need to set a starting goal. Maybe a big goal as well, but a starting goal. You need to know how you're impacted by that activity. What symptom does it cause? How are we going to break that down? And you gradually increase your exposure to those movement patterns and to that exercise over time to allow habituation and to allow desensitization. You even need to do things like considering the environments around you to complete those tasks. So maybe a pool isn't great. Maybe a leisure center is a horrible place to go because it's so echoey and noisy and there's so many bright lights and the motion of the pool and the water flowing everywhere is just disruptive. Maybe you just need to start in your backyard. Maybe it just needs to be calm and quiet. And then overall, we want to aim to achieve our total physical activity guidelines to minimize our risk of further chronic conditions developing, because we are not interested in having our life be further impacted than it needs to be by any of these dizzy conditions. And again, I recognize that that is a not nice thing to say sometimes, but it's true. And there's ways that we can work to things. And by all means, there might be some things that you really fear and you struggle to break through, but when we break it down one goal at a time, you find your support network. Maybe it's a group of dizzies that do that activity and they can help to guide you through. But it's really important that we very slowly and steadily work towards an intrinsically motivated goal and we habituize to that movement. And on that note, I am done. So I am happy to take any questions. I know I've fielded a few through the chat as I've gone. Sorry to jump on in, but Mickey, if you want to help field any that are popping up or coming through, that would be awesome.
Here we go. Regina, my main problem is I overheat when I exercise. So that was just a comment, not a question. And we've also got, so Anne's also put in there, one who has not exercised, what is recommended?
Yes. So I might start with the no exercise standpoint, because that's probably a little bit shorter to answer. So if you have minimal history in exercising, or as an example, maybe you've been stuck at home for a fair bit of time and you're not comfortable going out, tolerating walking around your house can be a very, very simple place to start. It's a way of ensuring safety in an area around you. You're familiar with the space. If you're having to rebalance yourself, you can get up, and we can progress that over time. Sometimes what I've done for people in those circumstances is actually start them off with breathing and just doing diaphragmatic breathing and sort of not hyperventilation techniques, but stressing their breathing a little bit so that you're becoming a little more used to the exertion that comes from walking. And we can do that sitting in a safe place where we're not triggering a lot of the rest of it. If that in itself is quite difficult and moving is just really not tolerated well, some simple sitting exercises can be really, really good. So some seated calf raises or heel raises where you're lifting your toes up is going to get the blood circulating through your legs. It's going to improve your body's sort of sensation with things on the floor. Quite often when we've spent a lot of time sedentary, we become hypersensitive to what we feel under our feet. And I think it's quite important to adapt to that as well. So I'd start with walking around the house. If you were struggling with that, more so some basic seated resistance exercises where your head is nice and still and you're not moving around. So even just reaching up above you or lifting your arms to the side, they can be good ways to start to get some tolerance back. But it's not a bad thing to talk to an exercise physiologist in that point. Or if you're seeing a vestibular rehab specialist, potentially actually talk to them about it too, because if they've got a physiotherapy background, they should know some pretty basic exercises to get you started with. In terms of overheating, that is a really, really good one. And it's one that can be quite difficult for any form of exercise. And so it can come down to situations. So ensuring your environment is controlled and appropriate, and you've got the ability to cool yourself down relatively rapidly. So obviously walking outside on a hot day is inappropriate. Pools can be quite good because the pool water is cooling. Otherwise, air conditioning or having like cooling cloths that you can put around your neck can be very, very useful. Sometimes that is also, though, around a gentle exposure to the movement. So if you get quite hot with aerobic activity in particular, because it's quite repetitive, maybe resistance training isn't a bad way to go, because you're going to have more time between the reps and the sets to let your system cool down and reduce the overall stress. But otherwise, I would be trying to implement as many cooling strategies throughout it as possible and determine if there's other things at play to that, or if it's just purely the overheating that's causing the fullness and the irritation to the system too.
Okay, we've also got Anthony asking if you have any basic exercises to improve balance.
Oh, that is a very hard question to answer. I think it depends on what's impacting your balance. If, let's say, you've had a history of Meniere's and the balance is deteriorated as a result of the vestibular system being impacted, I think it's really important to play off the other systems you've got. What's your visual system doing? What's your proprioceptive system doing? For somebody who has lower vestibular function and that's unlikely to change, how well is your other side working? Can we train the other side? If we can't train the other side, I am a big fan of your proprioceptive system being increased. So eyes closed, balanced, eyes closed movement. You can't just stand still for your balance. Your balance needs to be really good when you're moving as well. And then aside from that, maybe including which head positions you're moving through. A lot of people struggle bending forward and they get that fullness coming forward. So if you can adapt to having your head down and exposing that can be a good way about it. But if you have any vestibular function left, you want that to be trained well, and that's done through typical vestibular rehab exercises like a stable gaze head turn where your eyes stay on a set point and you rotate around. But otherwise, working on probably eyes closed balance to improve your proprioceptive system is really good.
And Matthew is asking about managing tinnitus when exercising. He becomes very loud with exercise, such as running.
Yes, that is really hard. And to be honest, it's something that's quite difficult to work around. Tinnitus is one of those things that is a very difficult symptom. And if you haven't gone about a more psychological is not necessarily the word I'm looking for, but if you haven't gone around kind of more of a mindful approach to your tinnitus, that might be something that I'd recommend implementing. If you have, my experience with people's tinnitus is not necessarily that it always changes that much. So then my concern would be more when your tinnitus flares, is that reflective of any of your other symptoms flaring, or is it just the tinnitus flaring and then it's just the annoyance of having the tinnitus there? If it's the tinnitus flares and then your symptoms flare in response, that's obviously not ideal. And maybe your tinnitus is flaring because you haven't habitualized to the task as well as you could have, or you will. But if you feel like that's not connected, tinnitus is one of those annoying beasts that is a little bit beyond what I treat typically, and can kind of hang around a little bit. But I've had a few people quite positively respond to some psychological and like meditative type management of that.
Great. Now we've got Stephen. He's asked if you could get a copy of the slideshow. I know we're recording this as well, so you can also get a hold of the recording, Stephen. So, and Hayley's nodding her head, saying that the slides can be made available. So we're good.
Yeah, I'm preparing a document to send through that can be shared with you all as well. That'll further detail things, not just from the slides. That'll be a bit more in depth.
Great. And we've got Gary who's asking, that might tie in with the package that you're putting together for everyone, but he's asking whether you have a Sydney practice or you could recommend someone that's Sydney based in exercise physiology.
I don't, unfortunately. I'm purely based in Melbourne, but we do run through telehealth. COVID was wonderful for that. So if you're struggling to find someone that you feel is appropriate for you, I can still have a discussion with you. I'm super happy to just pick up the phone and have a chat to you and help guide you that way as well. I know my details will be passed on after this session, but I'm quite happy to reach out to our Sydney exercise physiology community and see if anybody there has any awareness in particular, and then guide you in that direction as well. Our exercise physiologists are quite tight-knit, so I'm sure we'd find someone that you could start with.
Oh, okay, that's great. Anne, she's popped in the chat. Do you work with diet as part of your treatment?
It is somewhat out of my scope of practice to talk heavily about diet, but I think much like everybody, diet is quite important in the management. So I highly encourage people to become more aware of it and to consider, things like salt intake and caffeine intake and try to guide people to resources. But I don't specifically give recommendations purely because it's just out of my scope of practice and it would be inappropriate for that.
Okay. Anthony's given you a big thanks, a shout out, because you actually trained him over 2 years ago in Essendon.
That's so funny. Nice. Hey, Anthony.
So I think we've been through all the questions now. Did anyone else have anything they want to ask?
Okay, if anyone does have questions for Hayley, you can just run them by me and then I can send them off to Hayley, okay?
It can be quite a confronting and tricky thing to try and manage. So by all means, if you just got the lightest question you'd like to ask me or just some guidance around it, please pass it through.
Okay.
Thanks, Hayley. That was really good. Lots of really good information there. And just a reminder that Hayley will be sending through some info to Anne, and Anne will forward that on to everyone. So thanks again, Hayley.
No worries. Thank you so much. It's been a pleasure to come and chat to you guys, and I hope I didn't scare anybody.
No, you didn't. Thanks, Hayley. This was absolutely wonderful.